today we'll be talking about Medicare and changes to the health care plan for the future. The history of Medicare. Before Medicare started, it started with Social Security. In 1960, Medicare was added to the Social Security Act as a health care plan for low-income families and veterans and retirement and people who are retired. Coverage was added in 1973 for certain disabled persons and certain persons with kidney disease. Medicare legislation established a health care insurance program for the aged, retirement, survivors, and disability insurance under Title II of the Social Security Act. When first implemented in 1966, Medicare has two parts. Hospital insurance, this pays for inpatient hospital care. Skilled nurses, nursing facilities, and hospice care are part of that hospital insurance. The other part is Medicare medical insurance. It helps pay for physician, outpatient hospital, home health, and other insurances and other services. A third part of Medicare, sometimes known as Part C, Medicare Advantage, is the Medicare Advantage program. It was established as the Medicare Plus Choice program, and this program is also a self-pay. There's also a Part D. That part is self-pay. And here we have a charted percentage of the population, age 65, the elderly who are in long-time care, citizens that are 65 and older, under the age of 65, people that have chronic illnesses, and have an income below $22,000. And the population, again, age 65 and older, this is the population that Medicare serves. Persons who are entitled to Social Security, railroad retirement, disability cash benefits is what they also receive. Persons with end-stage renal disease. This was added with the Affordable Care Act. Before then, people with end-stage renal disease didn't qualify for Medicare. Non-covered aged persons who elect to pay a premium for Medicare, that's part of Part D, the self-pay. Any changes that I would make to this is expansion of children. Right now, children, even with a disability, do not qualify for Medicare. Even though they receive Medicaid, Medicare covers more with no payments. Medicare is designed to serve special populations. So this qualifies some people who are under the age of 65. The policy currently provides access to middle and lower income families. Healthcare is funded through a variety of private payers and public programs. Currently, in the history of it, when Medicare first started, it was completely private, federally funded. And since the Affordable Care Act, now it's partial private, partial public programs. Privately funded health care includes individuals' out-of-pocket expenditures, private health insurance, philanthropy, and non-patient revenues such as gift shops, parking lots. These are the ways that the government collects money in order to pay for Medicare expenses for society. Social Security pays out benefits as an earned right to retirees who contributed through payroll taxes. So when you get your check and you see that they took like $40 out your check, it's going to Social Security for when you become 65 and older and qualify. And that age has been going up. It's expected by 2020 to go up to the age of 68, I believe. It's a social insurance program. It's characterized by required payroll taxes, that's what we're discussing now, federal administration, and universal eligibility. Benefits available to all Americans regardless of income. Changes for the future. Policy changes recent with the Affordable Care Act have raised prescription drug payments, co-payments for the elderly. Even though there's some benefits to the Affordable Care Act regarding Medicare, expenses for prescriptions have gone up. There's been some restrictions as them not being able to get cheaper drugs. So I recommend that these payments be lowered through policy changes within the Affordable Care Act. Some Medicare enrollees, drug expenditures exceed their threshold and they enter into a coverage gap where they end up paying full cost sharing, increasing their risk for reduced adherence to adverse outcomes. Medicare could save about $33 million a year on certain prostate cancer drugs if it's reinstated into the policy to pay the price of the least costly drug. Federally funded. So if Medicare goes back to being federally funded versus the policy change with the Affordable Care Act, where it's private and public, that'll take us closer to universal health care. Now, when you talk about policy changes lately, everyone's talking about universal health care. Realistically, from the healthcare system we have today to making a change to universal health care, that's a drastic change. But if we make some small changes now within Medicare, like changing it back to federally funded, that gets us a step closer to universal health care. Then we can start incorporating that into other parts of the Affordable Care Act, other programs such as Medicaid. That will be a start. This policy will change to help create positive change in the health and well-being of our society.
I'm sorry now. Is this where Marcus' mother is?
Marcus.
For IT, tech work, tech hire?
IT is downstairs on floor 3.
403?
No, it's on floor 3.
Huh?
It's at the end, go to the end of the hallway and go down a floor to floor 3.
It's where?
The third floor,
Third floor. What?
into the hallway.
In the hallway.
On the left, ma'am.
On the left? Okay.
Thank you. Okay. So, currently, the healthcare agencies that accept Medicare, you have to call and ask a doctor. A lot of different facilities, hospitals, private doctors' offices, nurses' facilities, they do accept Medicare. However, now we have an in-network, out-network system. Now you can go see any doctor, but some of them don't accept it. You'll end up paying a higher rate. So you would have to actually go online to Medicare.gov. They have a physician compare tool where you can compare physicians to find certain needs that you have, to find the doctor you're looking for, and make sure that they accept your insurance. So if it's in-network, you'll pay less if you have a copay. If it's out-network, if it's an out-of-network doctor, then you may end up making some co-payments or paying additional charges. What I would recommend to add to this healthcare agency's policy is broader health insurance program. Like I said earlier, I would expand it to children to cover everyone, because there are a lot of kids who are disabled and currently they do not fall under Medicare. They do receive Medicaid, but they don't fall under Medicare. I would also recommend that private practice offices adopt this policy also, because right now there are a lot of physicians who are not taking new Medicare patients because Medicare may pay less than what private insurances pay. So they can't deny a patient. However, they can set limits on how many new patients that they take and how many new patients that they take that has Medicare. The goal of healthcare reform is to provide equal access to all Americans with no exclusions. Predicted for the future, right now there are over 7 billion Americans. Projected in the year 2050 is projected to have anywhere from 9 to 10 billion. and the future income level, the middle class is shrinking. We've all heard this, right? Since 1971, there were about 70% of Americans that fell in the range of middle class. And now we've dropped to about 40% of people who qualify for middle class. So these are people who have less income, who can't afford insurance. And insurance is not going up. Health insurance is not going up. I mean, it's not going down, it's going up. So we have income shrinking and medical expenses rising. This is why I suggest a proposal for new health care plans. Thank you all for coming. Does anyone have any questions?
No, ma'am, you summed it up. Thank you.
Thank you.
There you go.
Should probably do that because I'm really not. It's on my soft camera.